Cardiac cycle. All right, so here is the topic and outcomes, and really when it comes down to it, we're talking about Wiggers today. Okay, so phases of the cardiac cycle, we've got isovolumic contraction, which is here. Okay, we've got ejection, which is here. Then we've got isovolumic relaxation, which is here. And then filling, which consists of ventricular filling as well as atrial contraction. But like I said, this is all about Wiggers. Okay, if you haven't gone through Wiggers before, well, we're going to go through it again. And so Wiggers shows us the relationship between the left ventricular volume, the pressure in the left atrium, left ventricle, and aorta, as well as the ECG, heart valves, and heart sounds. Okay, so as we go through this, I challenge you to have a piece of paper and answer the questions. I'm doing this in a series of questions. Okay, so what happens to left ventricular pressure during isovolumic contraction, ejection, isovolumic relaxation, and filling? Okay, so during isovolumic contraction, pressure increases. During ejection, it increases, then it decreases. Relaxation, it decreases, and filling, it increases. Okay, so now what I want you to think about, well, what's causing these changes? Okay, the increased pressure during contraction, isovolumic contraction, is the ventricles contracting. During ejection, the initial increase is due to contraction of the ventricle. The decrease is due to the decreased blood volume in the left ventricle. To be clear, though, the ventricle is contracting the entire time and blood is leaving the heart the entire time. But at the beginning, the force of the increased pressure due to ventricular contraction exceeds the pressure loss due to blood volume, and then vice versa. Isovolumic relaxation, pressure is decreasing because the ventricle is relaxing, the chamber size is getting bigger. And then filling, it's increasing. So we have initial increase due to rapid filling from the left atrium. It still continues to increase due to reduced filling from the left atrium. And then we have a large but short or small increase due to blood being ejected from the atrium into the ventricle during atrial contraction. All right, let's do this again. So what happens to left ventricular volume during the following phases? So isovolumic contraction, ejection, isovolumic relaxation, and filling. Isovolumic contraction, we have constant volume. Ejection, we decrease volume. Isovolumic relaxation, we have constant volume. And filling, we increase it. So what is causing these changes? Physiology, cause and effect. Okay, isovolumic contraction. All valves are closed so the blood can't leave. Ejection, we open the aortic valve, and so blood is able to leave the ventricle and go into the aorta. Isovolumic relaxation is the same as isovolumic contraction. Valves are closed, blood can't leave because we're trying to reduce pressure so that atrial valve, the AV valve, the left AV valve and the right AV valve open. And then filling, we open those AV valves, blood comes from the atrium into the ventricle. All right, next, we have ECG, okay? So what's going on with the ECG when does it happen? Okay, so isovolumic contraction, we have the QRS, ejection, or isovolumic relaxation, that begins at the end of the T wave. And in the past, I've just said the T wave, and really to be as accurate as possible, that occurs at the end of the T wave. And then filling is the P wave. There's really not any electrical activity or wave that we talk about during ejection. So what's causing these changes? Well, isovolumic contraction, the ventricle starting to contract. During ejection, ventricle starting to relax. The isovolumic relaxation, that's when the ventricle starts to relax. And filling, the atrium is contracting. Okay, so that's where the P wave's occurring. So, next question, set of questions. When do the heart valves open and close? So remember, they open or close at the end of each phase. So at the end of isovolumic contraction, we open the semilunar valves. At the end of ejection, those valves close. At the end of isovolumic relaxation, the AV valves open. And you got it, those valves close at the end of filling. So what causes these changes? Okay, so at the end of isovolumic contraction, when the semilunar valve opens, ventricular pressure exceeds aortic pressure. They close at the end of ejection when ventricular pressure falls below aortic pressure. During isovolumic relaxation, atrial pressure exceeds ventricular pressure, and at the end of filling, atrial pressure falls below ventricular pressure. Last set of questions. When do these heart sounds occur? Again, think about it in terms of the end of the phases because that's when the valves open or close. So at the end of isovolumic contraction, valves open, so there's no sound. At the end of ejection, that's the second sound. That's dub. That's the closing of the semilunar valves. Again, at the end of isovolumic relaxation, valves open, they do not close. And so at the end of filling, the AV valves close, which is the first heart sound or lub. So what's causing this? Isovolumic, no heart sounds. Ejection is the semilunar closing. Isovolumic, no heart sounds. Filling, the AV is closing. So this is what I want you to do. Explain the relationship between pressure, volume, ECG, heart valves, and heart sounds. Okay? In other words, can you explain Wiggers? And take some time. If you understand this, it'll make your life a lot easier.